When is neurogenic bladder surgery a recommended treatment choice? Imagine living with a bladder that doesn't work quite right due to nerve issues. That's what neurogenic bladder is. It can cause symptoms like incontinence, urinary retention, or high bladder pressures. When these symptoms become severe or threaten your kidney health, doctors look for the best way to help. Sometimes, less invasive treatments like medications or bladder injections are enough. But if those options don't work, surgery might be the next step. Surgery is usually recommended when conservative treatments such as medications, behavioral therapies, or botulinum toxin injections fail to control symptoms effectively. For example, if medications like antimuscarinics or beta-3 adrenergic agonists do not reduce bladder overactivity or improve bladder capacity, surgery may be considered. Also, if high bladder pressures persist despite these treatments and risk damaging the kidneys, surgery becomes more necessary. One common surgical option is bladder augmentation, also called enterocystoplasty. This procedure increases the size and compliance of the bladder by using a piece of the intestine. It helps restore normal bladder storage and prevent kidney damage caused by high pressures. It is often recommended when injections of botulinum toxin into the bladder do not provide lasting relief or are not suitable for the patient. However, not everyone can have this surgery. People with certain intestinal diseases, those who have had radiation damage to the intestines, or those unable or unwilling to perform intermittent self-catheterization may not be candidates. If bladder augmentation isn't possible or fails, urinary diversion surgery might be considered. This involves rerouting urine flow to a different outlet, such as creating a stoma. This is usually a last resort but can be life-changing for some patients. Before moving to major surgery, doctors often try repeated botulinum toxin injections, which are minimally invasive and can significantly reduce symptoms for some people. These injections are typically given every few months and can delay or prevent the need for surgery. The decision to proceed with surgery depends on many factors. These include the underlying neurological condition, the current function of the bladder, kidney health, and whether the patient can manage self-catheterization if needed. Protecting kidney function and improving quality of life are top priorities. In summary, neurogenic bladder surgery is generally recommended when less invasive treatments do not adequately control symptoms, when bladder pressures are high enough to threaten the kidneys, or when other options are unsuitable. It is a carefully tailored decision made by healthcare professionals based on each person's unique situation. Always consult with a specialist to understand the best approach for your specific bladder condition and health needs.